Everybody. Thanks for joining us for this special World AIDS Day celebration of bringing together three organizations that are working in the arena to end HIV epidemics and to work with people who are at most risk for it. So I'm Alan Witchey. I'm the president and CEO at the Damien Center, and I want to take a minute to let the other people introduce themselves. Terry, would you like to go first?
Yes. Hi, my name is Terry Young, and I am the Director of Client Care and Retention at BU Wellness Network.
And then Todd?
I am Todd Lair, and I'm Executive Director of StepUp.
Great. Well, I'm really excited to have all three of us together today. This is once a year. This day happens on December 1st each year to remember the HIV epidemic, people who are living with the virus, and to commemorate the lives of people we lost and to celebrate the work that we're doing towards ending the epidemic. So I'm wondering if you could just give us a little overview of your organization, kind of your mission and the work you do. Terry, do you want to start?
BU Wellness Network, we are formerly known as Brothers United, but we're now operating as BU Wellness Network because we want to expand our reach. Our mission statement is to enhance the health and wellness of our community, including those that are gender, sexual, and racial minorities and the people who live and work in our neighborhoods. We do that by providing services on both the prevention side and by providing services for people that are living with HIV. So in addition to non-medical case management and CDC evidence-based interventions on our prevention side, we also offer linkage to care, psychosocial support, counseling services, and group social support as well. So a lot of different things happening.
Yeah, you guys are keeping busy, aren't you?
Yeah.
Todd, could you tell us a little bit about StepUp for everybody?
Sure. StepUp we opened our doors in 2003. We provide similar services. We provide comprehensive care and resources for wellness with dignity and inclusivity. So basically, we provide the same medical, non-medical case management connecting to resources such as food, nutritional products, help with housing, transportation, utilities for people living with HIV. I think currently we're serving about 500 plus HIV clients. We also provide prevention and outreach services, the education, testing, and distribute condoms and safe sex kits to bars and bathhouses across the city. Online education and outreach to people using social media and the online apps. We provide similar online. This year we provided a lot of no contact testing during the COVID times. We also have a reentry program with a series of programs for people reentering the workforce or the community from prison and from jail. So those are kind of some of the things that we do. We also have a Hep C program to help diagnose and treat Hep C.
That's excellent. Excellent. Great. I know just as a group, everyone's doing such amazing work in the community and really providing great services. So I consider it really an honor to be working in the same field as you guys, and I love the work that you're all doing. So people don't say it enough, so I would say thank you for the work you're doing. I do appreciate all the hard work and your teams do. And it really takes an effort in the community for us all working together in different ways to solve an issue like HIV. So it's complicated. I'm wondering, what do you guys think of this day? This is a World AIDS Day. What does it mean for you personally and maybe your organization? And I know some of you might be doing other things later today, so you can plug that as well if you want. Here, you guys have something coming up, right?
Yeah, we do. We have our World AIDS Day celebration is going to be this Saturday. It is virtual, and so everyone can go onto our website at buwellness.org and register for that event. You You can also donate to certain programs if you would like to, and they're listed and available for you there. World AIDS Day is always a huge day for BU Wellness because we always have our huge fundraiser around this time of the year, which is our World AIDS Day celebration. It gives us a chance to not only celebrate our clients and those that are living with HIV, but to bring awareness to our community about HIV and to provide some education, and then to also remember those that we may have lost to the virus. And again, just to celebrate the people that we serve and the people in our community that are either impacted or are living with HIV.
Right. And Todd, what does World AIDS Day mean to you? And is your organization doing anything unique or different related to it this year?
Well, I think World AIDS Day is about celebrating those people who come before us, who struggled, and many of them have lost their battles. Many of us, had close personal connection to some of those folks, and I think that it also is a time to remember how far we've come. Oftentimes, I'm sure the two of you, when you're out in the community, you talk to people who are not really connected to HIV services. People still think about HIV from the early 80s or from the mid 80s or even the beginning of the 90s when HIV was a death sentence, and it was about providing people a way to die, not a way to live. And I think so much of what we do now is to help people to live a normal, productive life. And so while we're remembering those people, they were definitely the pioneers. They were the ones that took medications that oftentimes made them more sick than the illness itself. And so we pause to thank them for, without their sacrifices, things that they went through, we wouldn't be anywhere close to where we are today to help those who are currently living with HIV. And I think, I think of, in particular, one person that I was close to in my life in the early 2000s.
Please come to the clinic, please. Nikki,
Right
to the clinic.
Right about 2000. And he was diagnosed with HIV and had also exposed his wife to HIV. And he couldn't talk about it. He felt like he couldn't talk about it because his wife was an elementary teacher and she was in fear of losing her job. And he felt like he had no place to turn. And he came to me one day in the office on a Saturday morning when I was working alone and talked to me about his case. Unfortunately, he lost his battle later on that year. But I think of people like him that there are so much more resources available to now, and our job is to continue to create opportunities for awareness of those.
Yeah, I think one of the things you said really struck me. I mean, well, first of all, just remembering our friends, our loved ones that we have lost. I think you're absolutely right. I mean, it's I think back on those years, and I have lost some really close, personal, good friends, and it's important for us, I think, on the day of today to celebrate their lives and remember them and continue the work, right? Because it's not over. And so I think this issue of honoring them by continuing forward and moving things forward is a really important piece of this day to me. But you kind of hit on something I think would be interesting for us to talk about, because the epidemic has really changed and evolved a lot, both treatment-wise, where the infections are showing up in terms of new infections and all of that. But there's still, I think, in general, there's a lot of maybe unawareness of the change in the epidemic, and the general public might have a lot of misconceptions still. And I'm wondering, Terry, could you speak to that? Like, how do you think we can, how do you think those misconceptions are still out there, and how would we change some of that?
So one of the things that we talk a lot about here in our CTR department and our outreach department is how do we disseminate the information and get the education out to the community. And that's also a big part of the Ending the Epidemic plan for the state of Indiana, is how do we get the information out to the communities. And that is what, that's our hardest issue right now. And so that is the primary barrier between people actually getting tested and being aware of their status and just being aware of HIV, is that they're just not getting the information. So we have a mobile unit that we take out, and it's been a little difficult with COVID, but we have still managed to do some on-site testing at different places that are still having gatherings, also providing PPE to people during those times. But it's just about getting the information out, not only to young people, but getting the information out to women. Women still seem to think that they're not impacted by HIV, and in reality, anybody who engages in any type of sexual intercourse is at risk of contracting the virus. It's also about talking to people about the risk factors. When you do the research and look at the research and you're out in the community, you see that there is a disconnect between what somebody's actual risk factors are and their perceived risk factors. So kind of bridging the gap, and showing people that, hey, this behavior, if you want to engage in it, that's fine, as long as you're doing it in a safe way, and here's a safe way to do it. So just getting the information out to the community is really important, and I think that it's going to be important for us to work with providers moving forward, and not just infectious disease providers or providers that are within this field, but we have to look at talking to primary healthcare doctors, maybe getting in and talking to pediatricians who are still seeing 16 and 17-year-olds. And so it's just finding different ways to get the information out to the community.
Yeah, I think that's really important about, the point you bring up about getting to maybe non-traditional partners and groups that we haven't necessarily thought of before, but are seeing people or connecting to people at high risk, or seeing people who are living with the virus, and connecting those partnerships a little bit stronger. And that is, I think, a future. So I agree with you. I think that was a really good point. Todd, what about you? What are your thoughts about ways that we need to sort of evolve or change our response related to the epidemic as we think about the next maybe 10 years?
Well, I think Terry's right, and then we need to expand our audience base. Too many. We spend a lot of time preaching to the choir, I think, and not enough time connecting to the broader community. And I think that she mentioned specifically one group. I think we hear a lot of times from some of our clients that they don't feel welcome in providers' offices. They don't feel understood. They don't feel like they can share, or they're told by their primary care physician that you have to go see another doctor to get PrEP because they don't provide PrEP services. And so, I think that we're going to have to reach those folks to eliminate those barriers so that people can remain healthy and access those services in a more integrated way. I don't think that, most of the time, I don't think there's any sort of nefarious intent there. It's just not having the full information available to provide that transfer of knowledge to the patients that they see. And quite frankly, that's not part of our broader healthcare system. That's not what people are paid to do. They don't view that as their jobs. And so I think that we need to take up that role and fill that space and try to fill that void as much as possible. I think we could make a huge difference in those places as well.
Yeah, it's true. Too often here at the Damien Center, we get a referral from a primary care doctor who basically says, I don't feel comfortable prescribing PrEP, or I don't know how to manage your HIV medications. Go to Damien Center, or go someplace that does. And I think that creates a barrier, because we kind of know, right? If the more places you refer people to, the less likely they are to sort of follow through. And so, like, engaging people where they are and where they maybe feel comfortable is important, but also, like, how to make sure that the providers feel comfortable and they know. I know we had a patient that was a PEP patient, right? So that's post-exposure, right? And so we know if you take the right medications after being exposed to HIV, you can, there's a very high chance, like about 98% chance, that you wouldn't get HIV. But this gentleman came in our door and said, like, oh, they didn't know what to do with me, so they sent me to you. And there's only this small window, right, to get that in. And so I think like working with providers and getting them comfortable and knowing how to address some of those things, that's a big issue in the community, right? And goes back to some of what Terry was saying earlier, like how do we bring along the community to make this more of a sort of a standardized part of medicine and the way we're addressing things, or should we? You know, like, is that the right answer, or does that maybe solve or create other problems? I don't know. What are your thoughts about that? Terry, do you have any thoughts on that?
I don't think that's going to create additional problems at all.
Yeah.
I think that's the way to go.
Yeah, that's good. Well, this is I wanted to bring up. You've brought up the ending the epidemic campaign. So that is a sort of a 10-year plan from the federal government, right, to try to end the HIV epidemic. And it doesn't necessarily mean that that nobody has HIV, right? It means that the number of new infections, trying to eliminate the number of new infections, and they kind of have these different pillars of sort of diagnose, helping people to know their status, helping people sort of get connected to care, and keeping people in care. And I'm wondering, what have you guys thought at your organization about, like, how are you going to kind of work into this ending the epidemic plan? What do you think is really important for your organization to do as part of this plan, and to be part of the community on this? Todd, what have you guys thought about that?
Well, I think the local plan is a good plan because, a task force spent months going through data, collecting the data, analyzing data, surveys and focus groups and such, to lead to this plan. I think that, we see our role as continuing a lot of the same things that we're doing, but maybe in different ways. And so obviously, one of the things called for in the plan is expanding community-based testing. That's something we've done for a long time, but I think, expanding on our conversation from before, we need to look at new opportunities, new locations. I know that a lot of the providers locally have vans, mobile units that they can take out into existing community events that we may not have been part of before, but may draw the people that are most at risk. I think that we're going to have to be creative in doing those things. Again, particularly during this COVID situation, we've invested a lot of time in trying to develop and further refine our outreach to using the apps. That's where people are connecting right now because of the COVID situation. And so we're really doing a lot more of our outreach that way, and trying to study what effectiveness we have there. So I think that'll probably continue. I don't see that use of technology going away, and maybe the use of other technology to further refine our targeting. I think that using the data, the tool chest is built. We know a lot of the things that work in terms of the tools. It's just being smart about where we go to find people who have not either been diagnosed and entered treatment, or those who are most at risk of becoming infected, and really taking that educational outreach, prevention, those prevention tools, and making people aware of things like PrEP, U equals U, and all those other things that are going to keep people safe. I think that's it. I think I was looking for the stats for 2019, and it showed that there were 218 diagnoses of HIV in Marion County during that year. And there are something like 87% of the 5,500 that live, people who live with HIV in Marion County know their status. But that's still a large block of people who don't know their status, who haven't been diagnosed, who haven't been in treatment. So, we want to get to those folks. Obviously, early treatment is key. But we think that this ending the epidemic campaign, in terms of the pillars, is really nothing new. I think it's just retooling a lot of what we have done in the past, and being more targeted about get to with that messaging. And I think sometimes that further complicates what we were just talking about is that, we're not really taking the message to everyone because we're being more targeted, but at the same time, that's kind of a smart approach to getting closer to the folks that you want to stop the transmission. So that's how I see us continually kind of refining our methods to get to the people that are most.
And have you changed some things in I mean, you mentioned sort of COVID as well, but like, what are you doing differently now that maybe you might be able to take into this ending the epidemic campaign as you think about that?
Well, I mentioned earlier that we developed no contact testing. I think that type of thing appeals to a certain audience. During this discovery phase of the task force, they tried to get at why people don't go seek testing. One big thing was they don't know where to go, and that's still a huge barrier. People don't know where to go. So we use technology things, and I think you all are probably doing the same thing, to try to push people to your website.
Right.
Electronically, so that they're more aware. But another barrier is that people are scared about what does this process entail, or is somebody else going to know about it? So if they're able to access services at their home where they're more comfortable, maybe that is a more labor-intensive approach to get to the people that you want to get to. However, if that's what it takes to get people who haven't been tested, then maybe that's the way that we're going to have to go with some people. I don't think it's a be-all, end-all solution, but it is going to be a solution for some people. And we have tested at least one person that was positive for HIV using that no contact testing. So I think that's something that's been added to our toolkit that I'm sure will continue.
Yeah.
Forward.
Yeah, we've been, just here we've been lucky in ways that we've been able to keep our traditional testing center open and having people in. We've been trying to focus more on scheduling, but I've been surprised at how many people, despite a pandemic, and people quarantining at home, how many people are still getting together and still showing up and testing positive for different sexually transmitted diseases and HIV. It's still, our numbers are still what they were before this, if not a little bit higher. So I'm sure that it's been, sort of a mixed bag for everybody. Terry, how about you guys? How do you see, BU Wellness stepping into this ending the epidemic campaign? And really, I mean, there's critical work that you guys do because the epidemic really hits hard in the African American community. The new cases are dramatically higher, and maybe you could talk a little bit about that.
So I kind of agree with a lot of what Todd said. Is taking a look at what you're currently doing and then try to expand on it and revamp some of it. We've been providing a lot of telehealth services, and we've been using the use of social media a lot and our website and internet. Like you were saying, we have not had any slowdown in our testing at all. Yeah. And it's actually really great that you can go directly to our website and schedule your own test and come in when it's most convenient for you. We're averaging like 10 to 11 tests a day, which is still really great, especially like we said, in the middle of a pandemic when people are afraid to leave their houses, they're still coming out to get tested, so that's great. We're taking a look at how we're using our mobile unit, but by doing that, so what we've done is we have drop-in centers every other Friday for the young people and the youth in the community to come and hang out, and we have our community health workers do spot interviews. And so through those spot interviews, we've been able to figure out where are people hanging out, who are your friends, what do you guys do for fun, and so then we're able to move our efforts more toward the priority populations. And like you said, it's really the epidemic, the numbers are still rising in the African American community, especially among same gender loving men and with Black women as well. And so we are really taking a look at how we're disseminating the information into those communities and providing services. part of that was the name change. So Brothers United doing business as BU Wellness Network, that really opened us up to start providing services, at the very least testing, to more people in the community. A lot of people were not coming through our doors because they just assumed that we were for men or that we were only for gay men. And that is not the case. We provide services, testing, and otherwise to everyone. And so we're really working with our outreach team. We've started using more community health workers. Our linkage to care provider is still going strong. And so that's an important piece, is keeping people maintained in care. As we know, before, most of the efforts were treatment as prevention. And so we're still looking at that. If we can keep people that are living with HIV on treatment and virally suppressed, then we will drastically decrease the numbers in the community. We're also looking at how can we get the word about PrEP out to the community.
Right.
PrEP has been around for years, and there are still African American, same gender loving men who are not aware of PrEP or the benefits, but they still have a lot of questions. And so we work really closely with our community partners and different companies to have virtual information sessions and to provide them with all the information that they need. We actually have someone on staff now whose primary job is PrEP navigation. So he's assisting clients, not with just providing them with information about PrEP, but here's your next appointment, this is where you're going, here's your provider, what other questions do you have, and then to still maintain that contact with them so that they have someone, if they have direct questions, they have a phone number that they can call and talk to someone directly.
It's great. I think it's really interesting. Part of the ending the epidemic is this idea of like disruptive innovation. Like how do you change the work that you're doing on a day-to-day basis? And I think you sort of both have hit on this, that there are things we know that work, right? There are strategies that have been successful for all of our organizations and working, but like what do we need to do different? Like, because that's at the core piece of this ending the epidemic, is that somehow we do need to do things different, and that disruptive innovation. I'm wondering if you guys could maybe talk to that, like, because it's I balance that a little bit in my head, because there's some things that I think we're doing tremendously well, and some things that we're just short. Even some things we're short on resources to do even better, and then on top of that, thinking about like what do we do new on this, or is it really just taking what we've been doing and tweaking it differently to help find more solutions? I don't know. What do you think about that, Harry?
I think it's a little bit of that, and then it's also asking the community, what do they need? So we have a community advisory board that meets, and some ideas we think are really great, and I'll come to the table with all these great ideas, and they're like, yeah, we don't want that. It's not going to work. And so it really is just the people that you're trying to reach, talking to those people and saying, what messages do you need? What information do you need?
Yeah, I was just going to say, I agree with you 100% about those community advisory boards. We have one too, and there have been times where you go in there and you think like, hey, I know what I'm talking about, and then you get in there and the group's like, oh, that's like a terrible idea. We want this other thing instead. And you have to be willing to do that, right? You have to be willing to say, like, I hear your voice, and it not only is it important, but it should influence what we do. And yeah. And I'm sorry, you were going to say something else too.
No. Another thing is that we talk to our clients that are currently living with HIV and ask them, what messages would you have liked to receive about PrEP? Where were you going before you contracted the virus, where you would have noticed a billboard about PrEP? And so sometimes it's just reaching out to the community and saying, where can we go to get this message out? Who's going to listen, and what words and what language and what visuals can we provide them that will actually grab their attention and make them hear the message? That's
great. That is great. And then there's this sort of balance between PrEP, which is a daily medication you can take, right, to prevent from getting the virus. And then there's this U equals U, which is undetectable, or virally, it's basically about viral suppression. Sorry, undetectable equals untransmittable. I'm having a hard time speaking today, apparently. And that's U equals U. And that is for people who are really, if you're living with HIV, it's very powerful. It makes you feel amazing that you can now be in control, that you aren't spreading the virus in a way that was not the case past, right? This is a really powerful thing that's come around in the last couple of years. How do you all balance that? Because it's sort of like two sides of the prevention equation, right? The U equals U and the prep. And I'm wondering how internally you think about that and balance the difference between those two, or is one, you just see one as a sort of a higher focus strategy. How do you guys deal with that, Todd?
Well, I think they're both equally important. I think everyone has a role. If you've already been diagnosed with HIV, I mean, your role is to, keep yourself in treatment and virally suppress so that, number one, you're healthy and you lead a healthy life, but number two, that those around you can lead a healthy life, continue to lead a healthy life as well. And so those that you love and those who love you maintain that. And then for those who have not been HIV infected at this point in time, there's a great shield to that. And so, you owe it to yourself if you're in a high risk group, if you're practicing more risky type behaviors, to try to protect yourself. And again, the ones that you love and the ones that want to keep you around for a long time. And so I think that everyone has a role to play in reducing the spread. And one of the things, getting back to kind of what you had just been talking about, though, I think that one of the things I think that we need to continue to focus on is you can't see people as one issue people. Like, if I look at a client and I say, well, I'm here to provide you with non-medical case management services, that's really easy for us as service providers to see people as like one issue. But, the social determinants of health kind of govern all of this. And so people just don't come to you because they need non-medical case management. They come to you because they may have a myriad of needs, and sometimes those needs are unspoken. Sometimes, sometimes in their lives, those other needs are more important than staying virally suppressed. Quite frankly, if I am worried today about where I'm going to sleep tonight, or if I'm in a domestic violence situation, or if I don't have food on the table for me and my family, those are going to be higher ranking needs than worrying about going to get this lab test to show to you that I'm virally suppressed. And so, I think that it's really healthy for us as service providers to always keep in mind to see the whole of the person and the whole of the need in these social determinant areas, because if we don't, we're likely to lose people because of that. We have to have that understanding that people need a myriad of services, and sometimes they're not even going to tell you what they need. We have to be asking the question, and we have to know our business well enough to kind of seek that out. It isn't maybe about just a missed appointment because someone was irresponsible. It was because they had something going on in their life that day that ranked higher than coming to see you as a non-medical case management person. And so, I think that we have to be responsive to the full needs of a client, and really ask some really pointed questions at times to really get to the needs that may be unspoken.
Yeah. I think that's a really important point, the social determinants of health, which not everyone is familiar with that phrase, but it is about the various different components in your life that drive you to make decisions and healthy decisions, and that sometimes one thing, a basic needs thing, might outrank your own personal health, and how do you do that? And we're all working at this intersection of poverty and health, and all these other issues that tie to that. And I think your point is well made that just addressing health, I think, diminishes the true issues and the scope that many of our clients and patients are facing. And that can be overwhelming. I mean, like, it can be very overwhelming to try to address all of those issues. And Terry, how do you guys decide like this is something we're going to make sure we address, and that here's maybe something we just don't have the capacity or ability to address in some way? How do you make those kinds of decisions?
On an organizational level,
Yeah, I think maybe on an organizational or programmatic level.
um, like you said, you have to look at your capacity. You have to look at the staff that you currently have working and be realistic. Um, if we take on this extra project, are we asking too much of staff? Are we stretching them too thin? Because when your staff gets burned out, then they're not providing the proper services to the community anymore, and then the community doesn't want to come to you because your staff is burned out. So
Yeah.
there's this cycle that you're playing in all the time. We provide the services that we are great at providing, and then we look at new opportunities to build upon those. Maybe not go in an entirely new direction, but so like for instance, we were just talking about having something to eat and how not having food and being impoverished plays into a person not maintaining their status in care and not being virally suppressed. So we started a food pantry. That was a very simple project that we can do, and so you can actually access our food pantry directly, or you can put in the request for a Kroger gift card instead. That was a service that didn't take a lot of manpower, that we were able to immediately roll out, and we see that clients are not only accessing it, but they're utilizing it, and it's benefiting their families.
That's
And
great.
so sometimes it doesn't have to be a huge, gigantic new project. It's just finding little things. And so we address more than just the person that's living with HIV. We through our psychosocial services, we're able to talk to clients about budgeting, developing housing plans, navigating food pantries. You know, if you have limited resources and you have no way of increasing your income, food pantries may be how you supplement. And so developing a plan with that client, that this pantry is open on these days, and so that kind of stuff. So we've been able to use our existing funding sources and just kind of tweak the services a little bit, to be able to expand and provide new things. And with having psychosocial services, that is such a broad category that we're able to tackle a lot of other client concerns and issues that are maybe outside of the scope of non-medical case management.
That's great. That is great. And then, I'm thinking because you were just been in these extraordinary times. What are ways that you're helping your clients and your patients deal with this sort of, and we've had very tumultuous year with the pandemic. Certainly, there's been a racial reckoning as well that has been going on. A lot of divide in the country as a whole, and these are issues that really intersect with HIV in a lot of ways. Racial equity, health, lots of different things, and you do have staff that have to sort of manage and balance that. How are you helping your teams get through it? I mean, at this kind of like crazy times, how are you providing support and engagement to both your clients as well as your staff? You want to answer that first, Todd?
Sure. Well, I would start out by saying it's not been easy. I think that we have amped up the amount of support that we're putting into things like housing assistance, transportation, and food resources, and all of those sorts of things. We've done some fundraising about specific client needs that have cropped up as a result of COVID. I think the jobs that our staff do every day are extremely stressful on a normal day. Just helping folks. There's never enough time in a day to do all that you think you should be able to do. And I think that that's been exacerbated by the stressors of not only COVID-19, but as you said, a lot of the things that happened this summer, the protests, the racial injustice type things. And I think that our staff has largely been working from home since March. We do have some folks on site in our offices, but majority of the staff have continued to work from home, um, and that can be isolating in and of itself. So one of the things that we've really focused on for the staff and providing the support they need is increased communication, meeting via Zoom and on a daily basis with their teams, being more available, communicative wise. We've also done some things like we have an internal team that we call the culture team that works on issues of morale with the staff, and so to try to help them with some of their stressors, we've met up at a local cemetery and done walks with staff through the cemetery so that they can be distanced and outside, but still have some interaction with one another and get some exercise at the same time. And those have been popular the times that we've done those. It's a constant issue that we're always looking for new ways. But those are some of the things that we've used this year to help support the staff.
And Terry, how has BU Wellness been supporting either clients or staff through some of these complicated days?
Same as Todd over at StepUp, we have increased office communication. Most of our staff is working from home. We opened our offices back up for a brief moment. That didn't last long. So now everybody's back working from home, but a lot more Google Chats and Zoom meetings. We're doing a lot of telehealth with our clients. We're also offering a lot of additional referrals for support as far as like psychosocial and mental health services for clients. So we have seen an increase in our referrals for mental health therapy, which is wonderful.
Great.
As far as with staff, we provide them that space to kind of vent, to talk, to let some things out, to still laugh and joke and have a little bit of fun on the job. But yeah, we just provide them with that space and then sending encouraging messages throughout the day, reminding them that, hey, I know you're working from home, but if you need to take a day or two, take a day or two. Even though you're at home, working from home is sometimes a lot more stressful. You've got your kids there, you're trying to homeschool them, your dog is barking, your contractor's working on your floors. So it's like working from home is not necessarily the best, especially for our non-medical case managers. They are struggling working from home when you can't have that face-to-face interaction with your clients.
Yeah.
Also, we've noticed that sometimes some of our clients are struggling with the telehealth because they're either technologically, they just can't keep up, or they just would rather see someone in person.
Yeah.
So that has been difficult navigating. How do we deal with people who need to deal with people?
Yeah.
So yeah, it's tough. It's tough, but we're making it through.
Yeah, we've seen a lot of that with our clients too. That that you might think, people might think like, oh, it's great you have telehealth options, but for a lot of people, that's might not be the way that they most engage, especially for a like therapeutic relationship or building some kind of relationship together. It can be really hard to do that in the same way online as you can do in person. So for us, it's been a great supplement, and a way to do it. But we still have quite a number of people we see in person for various reasons. There are certain things you just have to do in person, and some things that are just the patient itself. But it has been nice. I mean, having the tablet. So I don't know if you guys are doing it too. We have tablets that we can send to the patient. So if they don't have access to minutes or a smartphone or something, they can actually call us on the tablet and talk to their therapist or their provider and connect that way. But that can be really hard, especially when you're working with, populations in poverty that maybe haven't had a tablet before or don't feel comfortable for it. So sometimes this seems really easy, gets a lot more complicated when you actually have to implement it, in the end. Well, I'm wondering if you wouldn't mind, sort of as the last question for us, to maybe share your vision of ending the epidemic. Like, what does it look like for us, and what does it mean to you personally for ending this epidemic? Are there things that you think as a community we absolutely must do? And what would it mean for you personally to end ending the epidemic. Terry, do you want to go first on that one?
Sure. On a personal note, I can say that getting the information out seems to be the most important thing, at least in my community. And I'm just speaking, for myself here. There are a lot of Black women who are just not aware of HIV. It's like a non-factor when we're talking about STDs. That's the one nobody thinks of.
Right.
And so getting to a place where when we're talking about STIs and STDs, that we are including HIV in that, and that it's not just this mysterious virus that's off to the left that we pretend doesn't exist anymore. The numbers are increasing for African American women, primarily because we don't have the education, because we're not seeking the resources, and because we don't realize that we're at risk. And so I think that it's incredibly important at the base level to just get the information out there. And it's important for us to remember that HIV still exists. We did not eradicate it. It did not go away. It is not just impacting certain communities. It impacts everybody, and that we're all in this together as we're fighting this virus and trying to get to zero.
Great. And how about you, Todd?
Well, I think that, I think I said this earlier, it's an exciting time to work in this field, because I think there's so much innovation happening in terms of pharmaceuticals and technology that can really help us drive our messaging and connection to the community. But I think that, we have to spend a fair amount of time assessing tools that have been effective for us in the past and how they might be effective for us in the future. I think that the world has changed, is changing, is becoming more technological, so we need to utilize a data-driven approach to decision-making moving forward. I think that this ending the epidemic campaign has kind of sent us in that direction. We've got a good basis of data to build on, but that can't be where we stop. We have to continually seek and bring in additional data and analyze it. And that's not all number crunching. That is really having fruitful conversations with the people that we serve to bring in that data to make appropriate decisions about how we move forward. I would love to get to the point in 10 years or less where maybe my job is not necessary anymore because we've moved past this. Put me out of business. Help myself out of business. I'd be happy with that. I think we need to be dedicated every day to getting as close to that point as we possibly can, and using the resources that we have that are dedicated to this epidemic campaign to be as innovative and making that happen as possible. I don't think it's every day that social service providers like us are given an opportunity to be innovative. A lot of times, the money comes with very specific descriptions about how it has to be used, and that doesn't always suit the needs of the people that you're serving. And so, as much as possible, that this money is available within the constructs of the plan to be innovative. I welcome that opportunity to learn from what we're doing on a continual basis and to refine it as we move forward.
Yeah.
It's an exciting time to be in this field.
Yeah, it really is an exciting time. I agree with you. We really do. We have the medications, we have the knowledge, we have everything we need to end the epidemic. So we just have to deliver it, right? I mean, we have to take it over the finish line for all of us. I just think it's such an important time for us all to come together too as a community. I truly appreciate the work that both of you do and the teams. I know that you all have teams of people that work hard and really are working to move the needle on this. And I just think as a community, the more we can come together to help support each other, the more successful we'll be. So I thank you both. I think you're both fantastic workers, and you both represent amazing organizations doing fundamental critical work in our community. So thank you both today. Again, one thing to just end on is that tomorrow we'll all be on WFYI radio doing the all-in interview at 1 o'clock. So if anyone was here today and listening, join us again tomorrow for some more interesting conversation around how we've been responding both to COVID and the Ending the Epidemic campaign and other things that we think are important. So again, thank you both very much. Have a great day. And if for anyone who wants to learn more about any of our organizations, we all have great, wonderful websites. What's your website, Terry?
buwellness.org.
And what's yours, Todd?
StepUpIN.org.
And ours is Damien, DAMIEN.org. So please check us all out. We're all doing great work and worthy of support. So thanks, everybody, very much. Have a great day.
Thanks so much.